Home Care, a little bit about some programs they have. And if you all have questions, please feel free to put them in the chat. Or if you want to wait till the end, you can also write those down. And we will have time for those question and answers at the end as well. So I will turn it over. So thanks again for being here and stay tuned.
Yes. So like I was saying, home health, we're focused on helping patients recover from an illness, an injury, a medical procedure, chronic illness, just to keep everybody safe in the comfort of their own home. We are able to help prevent unnecessary rehospitalizations, help patients maintain their independence, and improve the overall health and quality of their life. The next thing is who can benefit from home health. Home health, is provided in the comfort and the privacy of the patient's home. Patients can benefit who need one-on-one instruction to help better manage their condition, their symptom, and recovery. Home health may be indicated if a patient has a new diagnosis or an exacerbation of an existing diagnosis, new or changed medication. They require teaching on a disease process or their medication. Somebody that's at risk or experiencing complications requiring labs, wound care, teaching, observation, and assessment. Somebody who's frequently in the hospital, contacts a physician's office frequently, exhibits behaviors that indicates he or she is at a risk for fall, needs physical therapy, occupational therapy, speech therapy, social services due to mobility problems, bowel or bladder incontinence, which we'll go over in a little bit, vision problems, ADL needs, or if someone gets a new medical device. Who pays for home health? Medicare and or Medicaid will cover the cost of home health services for patients over 65 who meet program eligibility requirements. Private insurance companies, managed care organizations, and other payers also cover the cost of home health services. The types of services that home health provides, provided by professional nurses, therapists, social workers, and home health aides. The team of professional works in consultation with the patient's physician to provide a full site of home health services and provide programs designed to achieve the best possible outcome. Those services include medication management and education on diseases or conditions, dietary and nutrition evaluation, treatment progress monitoring. They're able to help with the mobility challenges for those that are at risk for falls to minimize that risk, help managing chronic conditions, COPD, diabetes, and then we've got other programs designed to hasten recovery and improve the quality of life. So now April's going to talk.
Hello again. So I'm going to talk a little bit about what specifically we can do for your loved ones who have dementia and some of our specialized programs that we offer. The first thing that I'm going to talk about is the Active Minds program. Let's see. Give me just 1 second. I apologize. Okay. Common questions about dementia. What are the symptoms of dementia? Of course, those symptoms include problems with short-term memory, confusion related to time or place, or anything that your loved one would typically remember. Problems speaking or writing, misplacing items. You all are familiar with that or probably have likely experienced that at some point with a loved one. What causes dementia? Dementia is caused by damage to brain cells. The damage interferes with the ability of brain cells to communicate with each other. When brain cells cannot communicate normally, it can affect thinking, behavior, and feelings. You all know that it affects everything about our loved one, everything about their life and their quality of life. Common questions about dementia. How is dementia treated and how can our agency help? We utilize evidence-based strategies to help stage and treat your loved ones based on the level of dementia that they have. Our goal is to tailor treatment based on their unique presentation. No one's care plan would be identical to someone else's. We tailor that care to meet that individual's needs. Millions of men and women of all ages struggle with memory loss due to dementia. The good news is that many people can improve their quality of life and delay the need to move to long-term care. This specialized treatment program is available from the comfort of your home. Over 5.8 million Americans suffer from some form of dementia. Do you or someone you know have a problem remembering familiar names or events, experience confusion and have difficulty following conversation, have sudden mood swings during the day, experience difficult speaking or writing? Is there anybody here who can answer no to all of those questions? Probably not. Our loved ones have probably, if they are suffering from dementia, have experienced those things at some point or another. If you answered yes to any of the above questions, you or your loved one may be suffering from the early stages of dementia. So this Active Minds program that we have put together, what sets us apart from other programs are strategies that we teach for communication, the fall prevention strategies that we teach, actions to improve engagement, which can be several things: puzzles, games, tasks, crafts, different things that we put together to engage those patients that are suffering from the memory loss. We have a lot of strategies that we put together to help caregivers decrease their stress level, and also tips to avoid caregiver burnout. So we not only focus on the patient and trying to help improve that patient's quality of life and their functional mobility, we also focus on the caregivers and trying to teach them how to alleviate some of that stress and prevent that burnout that a lot of caregivers, feel at some point during the disease process. So that's the Active Minds program. In addition to that, you all know that a lot of our older folks who have, are suffering from the dementia and memory loss have trouble with incontinence as well. So we also have an incontinence control therapy program. What are the symptoms of incontinence? Urgency, frequency, nocturia, which is waking to urinate, dysuria, painful urination, or nocturnal enuresis, which is leaking urine while sleeping. If your loved one is suffering from that, we also have this program put together to help them with that. What causes urinary incontinence? There are many causes of urinary incontinence. One of the most common is pelvic floor disorder, caused from the weakening of the pelvic floor muscles. Weakened muscles can result from aging, other medical conditions, chronic constipation, or childbirth even years later. Other common causes can be urinary tract infections or use of diuretics. Incontinence kind of goes hand in hand with the dementia a lot of times. And of course, as we progress through those stages of dementia, a lot of times it worsens. So, depending on how early we catch that, there are things that we can do to help minimize the effects of that. How can we help? Our team of specially trained therapists create individualized treatment plans. Our in-home continence control program includes lifestyle changes and simple seated exercises. It is easy to do in the privacy of your home and without worry about side effects. How is urinary incontinence treated? Lifestyle changes, exercise, and medication are effective for most patients. In some rare cases, surgery is required. But hopefully we are able to intervene before that point. And again, that's based off of the stages of dementia that we are currently in. Over 25 million Americans suffer from some form of urinary incontinence. Does your loved one have trouble making it to the bathroom in time, experience dribbling or leaking of urine with sneezing, coughing, or physical activity? Are they getting up multiple times during the night to use the bathroom? Do they wear a pad as they are concerned that they may have urine leakage during the day? Of course, if they do, or you've answered yes to any of those questions, then those patients would likely be appropriate for the incontinence program. So we have a little bit of trivia that we want to do with you guys, and I'll let Taylor take over with that.
Before we do that, I'm going to go over kind of, now that they've kind of discussed their programs and have kind of covered the, the Home Health 101. I'm going to go over just kind of home places, assessments, a little bit more in detail. I know we've kind of touched on these in previous conversations, but I feel like it's a really good time and a good stepping stone for us to kind of talk about how the programs that Methodist Home Care offers and how we're going to utilize and work as partners with our community agencies to provide care to our future residents. So as you all are aware, what we've discussed, I think before, is for anyone to come live at Homeplace, an assessment will have to be completed. So what that will be is it will take place, just like probably your home health assessments, wherever that loved one is. So if your loved one is at home, or if they are at a hospital or rehab community, and you all decide that that person would need more assistance or care, that was when we would want you to call us, and that way we can come and assess them to ensure that we have the things that we need to provide the best care for your loved one. So we say it's a thorough assessment because it is. It is going to be a detailed assessment because we feel like it sets up us and those that we care for at Homeplace of Henderson up for success. So our assessment, we obviously want to talk directly to the person who will be receiving the care, but also we realize that family, close friends, or whomever else is involved in that resident's direct care is important to be a part of that conversation. Because I know in my career, sometimes those potential residents paint a better picture and the family member standing behind them shaking their head no, because they're not always transparent. So we want to have a true depiction of what that care needs to be and how we are going to provide the best care to that individual. So we'll go wherever that person is. The assessment will be based on the needs and evaluation from the resident. We'll also, again, we'll talk to the family. We'll talk to the primary care physician. We also will obtain some information from that primary care physician, such as a physical, current med list, anything that would provide us the best information to set up a plan of care. We also would bring in the home health. If home health is currently involved, we would definitely want to notify them of the move-in and bring them on board as well, because they are able to come into the community as well. Hospice and any other agencies that would be involved in that loved one's care, excuse me. So our conversation from that thorough assessment will allow us to better understand the potential residents' needs and develop a detailed approach to their plan of care. So this will be done, generally the admission or the assessment that we do will be done by our nurse, who we will employ at Homeplace of Henderson. So they will come out and visit this individual wherever they are. If we do get referrals, one of the things I always say is someone sometimes looks different on paper than they do in person. So I can always guarantee that we will come and do an on-site assessment, even if we know or unsure if this person would be appropriate. We always want to have the family and be transparent with all of those involved and make sure that they're getting the level of care that they need. So the assessment, it's an initial one, and then it kind of is continuous throughout the process at Homeplace after admission. So if our direct caregivers on site are identifying the changes in the condition, or they're documenting the needs of this individual to be changed, maybe they're refusing their medications, or maybe they're not bathing in the mornings, they actually prefer it in the evenings, or they're refusing to change their depends frequently. So we're going to have to do some, determine the best possible way to resolve these issues and discuss those things with the family and maybe take a different approach. So those assessments are continuous even after admission. And then we will partner with outside agencies if we feel like the individual would need some extra assistance from a physical therapist, a speech therapist, those things that Taylor and April discussed earlier. We will assess our client's needs for a medication management. So our nurse will be able to set up some pill boxes. So the family is not local, but actually is out of town and doesn't have access to be able to be in town to set up a pill box, and their loved one does not feel safe or comfortable doing that anymore, we can do that. We also will provide reminders throughout each day. We also always want to assess the hygiene and grooming to ensure that that individual is cleaned up, especially if they're going to be engaging with other individuals, make sure they've gotten cleaned for each and every day to encourage activities so they don't feel like they have to be isolated. So we will ensure that that is done. We also can provide transfer assist. So a lot of our individuals, as you all know, use walkers, canes, wheelchairs, motorized scooters. And so we will be able to provide a transfer assist if needed. If they do need some 1 to 2 person assist, we'll be able to offer that support to them. I'm going to go back, I'm going to go over nutrition support and come back to that. Cues and verbal reminders will also be documented. How does this individual work best? Do they do good with verbal? With cues, what types of things work in the home? What types of things can we ensure that we do when they come to Homeplace? Communication, we've talked about this in previous conversations. Sometimes nonverbal communication is more effective. Sometimes, calling them by a nickname, sometimes calling them, by first name, which is recommended as far as the education that I've been taught has told us. Some communication, how is this person best communicated with, and how do we make their days fulfilling? Toileting is something that April and Taylor both were very thorough on the program that they offer at Methodist Home Care. Bathing, ambulation support, health monitoring. We will be able to, take oxygen levels, check blood pressures, do things, take weights if the doctor recommends that needs to be done, we can do so. We also will provide social engagement to make sure the spiritual side of things or whatever it is that interests them and really gets them going and puts a smile on their face, we'll ensure that's assessed as well. The other thing is nutrition support that I want to go back to. As needs change, sometimes individuals may need, a soft diet, or they may need to be on a liquid diet, things like that. So we will have a nutritional team as far as the kitchen staff goes and be able to accommodate those things. And document, what your loved one is eating. Are we doing boost? Are we doing ensure? Is the family providing this? Those types of things to ensure their well-being as well. We know that getting accurate information during the assessment is vital. We know we want to set our staff and future residents up for success. So that thorough assessment from move-in is continued throughout as a reminder. We want accurate, and so that initial assessment makes the first days after a resident's move comfortable and enjoyable. As you all know, a move is very difficult, especially for those back in our memory care setting. We have 24 memory care rooms, so that will be specialized for individuals with Alzheimer's or another form of dementia. So it's important that we get all avenues so we can do our very best to ensure those first days are the best days. The assessment is important. It sets up staff and residents for success, like I alluded to previously. We'll ensure that the residents' personal care needs are met, or not only met, but exceeded. So it's the first step of a resident's new life, and we want to make sure it's happy and peaceful for all of those involved in their care. So that's a little bit about it. I have, a guideline that we're still working on. But I know you all probably can understand from the previous slide, transfer, the assistance and different things that we're going to be able to offer. And it will be detailed so that we can do our best and provide exactly what you all need for your loved ones or those in our community.